What is asymptomatic TB and how does it spread? Imagine carrying a tiny bacteria inside your body without feeling a thing. That's what happens with asymptomatic tuberculosis, also called latent TB infection. In this state, your immune system has kept the bacteria, called Mycobacterium tuberculosis, under control. The bacteria are present but inactive, so you don't have any symptoms and you can't spread the disease to others. This is different from active TB, where the bacteria multiply and cause noticeable health problems. When someone has latent TB, their immune system forms a barrier around the bacteria, stopping them from growing. Because the bacteria are dormant, there's no cough, fever, or weight loss. Usually, latent TB is found through skin or blood tests that detect infection. Chest X-rays and sputum tests won't show active disease because the bacteria aren't multiplying or causing damage in the lungs. Active TB disease happens when the immune system can't keep the bacteria in check. This leads to symptoms like a cough that lasts more than 3 weeks, chest pain, coughing up blood, night sweats, fever, weight loss, and fatigue. If TB affects the lungs or voice box, it can be contagious. When a person with active pulmonary TB coughs, sneezes, or even talks, tiny droplets containing live bacteria are released into the air. Others nearby can breathe in these droplets and become infected. Here's the key point. People with asymptomatic or latent TB do not spread the bacteria because the bacteria are inactive. They are not producing the bacteria in their respiratory secretions, so they are not contagious. Only when TB becomes active and affects the lungs or throat does it pose a risk of transmission. That's why screening and treatment of latent TB are important. They can prevent the bacteria from becoming active and spreading later on. In summary, latent TB is like having a sleeping bacteria inside you. It's harmless and not contagious until it wakes up and causes active disease. If you have latent TB, your immune system is holding it back, but if your immunity weakens, it can turn into active TB, which can then spread to others. That's why health authorities recommend monitoring and sometimes treating latent TB to prevent future problems. Always consult healthcare professionals for proper testing and guidance, because understanding the difference helps protect both your health and the health of those around you.